Today you're going to learn my top 3 neck exercises to make you feel more comfortable if you have a stiff neck, achy neck. You can do today in your own home. We're going to give it tons of information if you stay tuned about how to feel better today. So these exercises, we've been using the clinic for years. The way we arrive at these exercises is using the McKenzie Method, and it's a systematic evaluation. We're taking through a series of movements, retractions, looking up, side to side, to find the movement that reduces your pain and improves your movement. You just feel better, you move better. Okay, so these aren't personalized, so if you're having trouble with these exercises, realize sometimes you need an evaluation to find the right one. But we're going to give you the top 3 ones and kind of explain how to do them so you get the best results. And if you don't, you just may need a formal evaluation. So let's talk about the tissues involved. What exactly is causing this pain? Oftentimes, people and practitioners, therapists and doctors will say, I think this is muscular, I think this is ligamentous, I think I have a disc problem, I have arthritis. What we find is that it's very hard to tell in the spine what specific tissue is causing the pain, or they'll say, what is the pain generator? So we can't always tell you that this specific tissue is bothering you, or this, there's certain things we think, are causing some problems, but what we're looking for is a movement or a posture, like we give you one position to hold for a little longer, or a more upright position. Does it change your pain? Does it actually make you start feeling better or moving better, like your mobility improves, pain decreases, you feel more comfortable? That's what we're looking for. And a variety of these exercises can help you with people that have been diagnosed with spinal stenosis, disc bulge, spinal arthritis, degenerative joint disease, degenerative disc disease. All those can be found to be helped by one of these exercises or all 3. Most times we want you just to do one exercise before we do all 3 that we're going to show in the video, just to see which one really has the greatest impact on how you move and feel better. So how do we know if these exercises are safe? That's the most important thing. We want to know, whatever we don't want to do more harm, all right? You already have some neck problems, maybe you have a little arm symptoms too. We use a concept called centralization and peripheralizations, okay? And what that means is if we have, let's say, a neck problem here, there's a nerve coming off the neck here, okay? And it's inflamed. Let's say a disc or some swelling or something is affecting that nerve, and you're getting, let's say right now you're getting elbow pain to shoulder pain, like all your pain's radiating the upper back and down here. If we have you start doing a particular movement and we start saying, wow, the pain is moving up, it's no longer in the elbow, it's actually here. So the furthest down is right about the shoulder, let's say it's right about here, or even at the tip of the shoulder, and you'll do the exercise or movement, and they'll say, wow, this is moving up. That's a good sign. That's called centralization. It's going to where we think the origin of the problem is, the nerve being kind of pinched up here, if that's in fact where it's coming from. If you do a particular movement, let's say you do a flex position like this, and let's say before you started the exercise, you said, well, I have shoulder pain. Now let's try this exercise. Looks like it's going to be beneficial. You start doing the exercise. Now the pain is out of the shoulder and it's radiating to your arm, or maybe if you're feeling something further down below the point it started. So that's called peripheralization, okay? So one of the rules that helps us as physical therapists and patients is when we give you this exercise, and most times I'm giving you one exercise to take home, I want to make sure that you know if the pain's moving up and towards where we think it's coming from. That's a good sign. If it's starting to move down and into your hands, that's a bad sign, depending on where it started. If you start with hand pain, whole hand is numb or whatever, and then it starts moving out of here, there's no numbness here, the furthest the pain goes down is the elbow, but it started in the hand, that's good too. It's moving up. And slowly, the idea is that you slowly move further and further up, right to where the pain is, and it's originating from, and hopefully, eventually, over time, get rid of it completely, so there's no pain at all of the neck. So that's a safety in the system, and as long as you go about it systematically, and you understand the rules of the road, you know what's a good pain or a good movement, and what's a bad movement. So that's one of the safeties in the system to make sure you don't do any more harm and get in a situation where you're worse than when you started. So when you do these exercises, realize these can be very painful conditions, but it doesn't mean that you really have something that's horribly wrong with you. okay? Incredibly painful condition doesn't mean it needs a complex answer to it. And what I mean by that, it doesn't mean you absolutely need an injection, you need surgery. What we might need is just a movement that actually clears the problem out. You know, it doesn't have to be as big as something that, you know, something that's really wrong with you. Almost something like a pebble in your shoe. It's incredibly painful when the pebble's in there, but there's nothing really wrong with your foot. You remove the pebble, things feel better, you move better. Another analogy I give people too is it's almost like we're trying to find a movement that's going to put your back or your neck back in place, back in balance, similar to kind of getting an adjustment, you know. That old dresser drawer that's kind of a little bit off its room, it's kind of binding. You can't close that drawer, and until you kind of get the right movement, then it tracks better and it moves better. And a lot of times I feel we're merely just balancing the system and getting the right movement for your particular neck problem. And there are certain ones that are more common, like we said, and the top 3 that we're going to give you, we'll explain those. Listen, you've gotten a lot out of this video already, and you kind of understand a little bit more where we're going. Please share this or like this, or send us a comment. We'd love to hear from you about some of your questions, concerns about the next 3 that are coming up. All right, so let's go on to our top 3. So the first one is a Slouch Correct exercise. Basically, it's taking yourself from a position that is a more forward position or flex position, if you look from a side view, and then changing position and getting the endurance for ears of the shoulder, little arch here, head kind of neutral, and kind of eyes on the horizon. Hold 1, 2, and come forward like this. All the way up. 1, 2, and slowly you're getting the endurance for the right posture and position. Also, many times people that do have pain, you know, and you can do all these exercises when you're having pain. It's supposed to reduce or correct the pain. Oftentimes they'll say, wow, I feel a little bit better when I sit up more upright. That's a good sign that we've gotten a little bit better posture and position. You want to do it in a chair where you have no back. You can do it on a stool that doesn't move, or a chair that doesn't have a back, okay? But basically it's you're slouching, and then you're correcting, getting that good position. So you can feel what a neutral posture is, little arch, nice and upright, and works on aligning ourselves a little better. And sometimes in itself, it could actually start making your neck feel better. And you see a little cause and effect. If this is truly a mechanical problem, something that can be solved with therapy and all that, you'll see a change in that position will change how you feel. And over time, it'll start translating into you feeling better. But it's called the Slouch Correct. That's the first one. Number 2 is called the cervical retraction. Okay, the cervical retraction is basically sitting upright, getting in that first position. Make sure you're kind of as aligned as you can. Oftentimes there's a loss of motion that you don't appreciate. This is a very hard exercise to do correctly because it's hard to see from a side view where you're moving. So you're essentially doing, your chin is coming back, you're retracting, and back. This is just showing the direction, almost like we're on a railroad track. Straight back and release. So you can see there's not a lot of movement in the neck, but that amount of movement is correcting, and it's oftentimes you'll see an improvement in all planes of directions, meaning whether you're turning to check your blind spot in your car or you're looking up, it'll improve the overall motion. If it makes it worse, like we talked about earlier, then obviously we're either, 1, doing the exercise incorrectly, or it's not the right exercise and we stop, okay? So it's a cervical retraction. I use my hand or my web, they call this the web space here, and you can cup your hand and add a little bit of pressure at the end. So pressure on, pressure off. You must get to the end of the motion to get the right stretch. If you do just half the distance and don't add that extra pressure where it can't go any further, you're not going to get the full benefit of the exercise. You have to go as far as that neck allows. It's very common to have some pain at the very end, and then once you release it, it's gone and it actually feels better overall. A couple of minutes of a little stiffness, a little soreness afterwards is okay, but it's supposed to make you feel better overall. Okay, so that's a cervical retraction. So our last of the 3 exercises is a cervical retraction with extension, okay? You want to sit up nice and tall, make sure you have good posture. You're starting out the first one, just like the cervical retraction, you're doing that first part. So you want to come all the way back, retract back. You want to get to the very end range, just like we talked about, you know, doing the exercise, but then you relax it, let the head fall back, and then do a little side-to-side wiggle. And back down. You got to get to the end of the motion. And this one, we want to get to the point where almost our chin is level with our forehead, okay? That's kind of the goal. Everyone varies a little bit at the neck, but that's one of the goals we have. And I've had people that are 70 or 80 get to that point, and then other people that were 20 that couldn't. But the norm is that we want to get to this point where we're almost level with the floor. Forehead and chin are almost the same height. So let's go over it again. So retraction, a little bit of pressure, and all the way back. Get as far as you can go. You should feel like I can't go any further. And a little wiggle at the top. And then back down. So that's a cervical retraction and extension. So these exercises, I think because we sit so much and we're just sitting more than ever. Driving, we're not standing as much. When we sit, we're kind of in a C society. We're kind of the C position here. And we lose the ability to come up, and we lose that ability to get upright and hold our posture. So I think that's why these exercises are typically kind of successful compared to doing more forward exercises or forward flexion exercises, because we're doing a lot of the flexion already. We're already kind of putting ourselves in those positions. So I hope this helps you out there. You know, a personalized evaluation is sometimes what you need, but a lot of people get a great deal of relief from this. So I want you to try this. You want to do 10 to 20 times every 2 hours. Like I said, spread it throughout the day. Don't sit. Sit is the new smoking. Don't sit more than 30 minutes at a time. Get up, move around, but spread these exercises out. And after 3 to 5 days, you'd see a trend of whether more the exercise is centralizing, like we talked about earlier, or just getting less intense, you feel less stiff. Okay? Listen, I hope this helps you out. It would make my day. Send me a comment, like it if it helped you out, share it if you have a friend that's having some trouble, but start something today and hopefully you can start moving and feeling better. Check out our other videos, sleeping with a stiff neck, and also is carpal tunnel coming from my neck. Have a great day.